Hello everyone. It's been 10 days since the first day of the quarantine in Wuhan. I want to show you guys how's it going in the city, how's it going with the patients first. Let's see a report from Caijing. Here we see a picture of a corridor in the hospital. You can see people on the sides doing IV drops and people here lining up probably for a checkup. And this guy is probably carrying a CT scan of the lungs. A doctor told the reporter that every day there are around 120 patients here seeking for help. Among them, around 80 is suspected cases of coronavirus, but eventually they can only take around 5 people in. He said, "We have to tell the rest of the 75 patients to go home. They don't know what to do. We don't know what to do." Here, there is a form showing the available beds in the Wuhan hospital. You can see among all these hospitals, none of the beds are available. The hospitalization process was simply too competitive, too time-consuming. Most of the people who have the symptom, they are either isolated at home or they die before they can get properly treated. That's probably why there's such a low number in the official report, because most of the people are not included. They're not included even in the suspected cases pool, because for confirming your cases, you have to go through a lot of process. For Mrs. Wang, both of her parents were infected. She was taking her parents to all the hospitals around Wuhan to see if any hospital would let them in, but none of them has bed. She was when she was trying to get her parents hospitalized, she found herself infected and her husband also. When she heard that one of the hospitals is opening an additional 700 bed, she was very happy. She took her parents to this hospital, but it was 9 p.m. at night. The staff there said, "There are simply too many people outside of the emergency room, and we don't have, the emergency devices now to save you if you die in the line." They advised her to go to a different hospital, but the second hospital won't allow them in also. At the time, her mother eventually made a decision. She was pleading the staff, "If I'm gonna die, I'm gonna die at home. I'm not going out anymore. It's hopeless. Please, can you take me back?" Mrs. Wang had no choice. She signed the decision letter. One of the doctors in a qualified hospital said, in their hospital they have 600 people with serious symptoms, but none of them has a diagnosis. He said, "We don't have enough testing it, and we don't know why." According to the Wuhan government, all of the people who's having the symptoms have to report it to their community, and their community gonna have an assessment of each patient. They're gonna report a list of names who they think that should be admitted into the hospital, and after that there's a whole lot of process you have to go through before you're admitted. Mrs. Liu was trying to go to the hospital to get the testing kit, and she was told that they only have 10 testing kits for each day in total. And what kind of patient could get to use the testing kit? They will need the report of a doctor, which allows them to apply for the testing kit. But only in very emergent situations, the doctor will fill in that report card. The Caijing reporter was asking what kind of situation is very emergent, but he couldn't get an answer. Those people who have personal relations or connections, especially to the government, they have a much better chance of getting admitted into the hospital. That is not the only way. For example, this woman, she was pregnant for 8 months. Her family members was seeking help online on Weibo, which is a Chinese Twitter equivalent of Twitter. They were getting enough attention because she was pregnant for 8 months, so she was getting enough attention online that she was getting the attention of the local government. And after that, they were very quickly admitted into this hospital just besides Wuhan University. But this is good news for their family, but probably bad news for those who were supposed to be in line, before her. One family member of a patient told the reporter in Caijing, "Is it just whichever baby cries the loudest, whichever gets to live?" The actual death number in the crematory service is highly secret. No one knows about that. But this guy, whose father was dead days ago, he said it took 10 hours for the crematory's car to arrive to take the body away. They said they're too busy. They have to take several bodies on the way. There's a footage of a little girl who watched her mother's body to be carried away by the car of the crematory service. Let's see the footage.